This is gonna blow your mind. Did you know your nails can reveal a lot about your overall health? Well, today we're diving into the top tips for perfect nail health. Also, stick around for special tips from a dermatologist. First up, hydration is key. Just like your skin, your nails need moisture to stay strong and flexible. Drink plenty of water, and don't forget to moisturize your hands and nails daily. Next, let's talk about diet. Eating a balanced diet rich in vitamins and minerals, especially biotin, can do wonders for your nails. Think nuts, seeds, fish, and leafy greens. Now, on to grooming. Keep your nails trimmed and filed regularly to prevent snags and breaks. But remember, no aggressive filing. Gentle is the name of the game. Also, push back your cuticles instead of cutting them to avoid infections. For all you polish lovers out there, give your nails a break. Constantly wearing nail polish can lead to discoloration and weaken your nails. Try going polish-free for a few days every month. And last but not least, practice good hygiene. Keep your nails clean and dry to prevent fungal infections. And always use clean tools for your manicures and pedicures. Oh, before we forget, check out this video from dermatologist Dr. Sam Ellis.
Nails. Thickened, yellow, or discolored toenails can be a huge source of embarrassment for people, so let's talk about it. By far and away, the most common causes of irregular toenails are trauma and nail fungus. And oftentimes you can have both. This often starts with trauma to the nail. This can be chronic repeated trauma, like slamming your toe against the front of your hiking boot over and over and over again, or single trauma, like dropping furniture on your big toe, which for whatever reason seems to be incredibly common. But from there, the toenail begins to grow out irregularly, and any irregular growth in the nail then makes the nail a more hospitable place for fungus to colonize. If you're looking down at your irregular toenails right now and you're going, I don't know if it's from trauma or it's just fungus, the easiest thing you can do is go to your dermatologist. We can take a clipping of your nail and send it for testing to see if there's any fungus growing there. Also, if you have fungus other places on your body, like foot fungus or tinea cruris, also known as jock-itch, then it's much more likely that your discolored toenails are because there's fungus there too. Now, if you test the nail and there's no fungus or mold growing there and it's just due to trauma, then one, if the trauma is still ongoing, you can do some behavioral interventions so that you don't keep injuring the toenail, and hopefully it can grow out regularly in the future. But if you injured it one time a long time ago and your toe has never grown out the same, then you kind of have to live with it. And I don't say that to be Debbie Downer, but just realistic to what your expectations should be. And then the goal shifts from ever having a normal nail to keeping that nail growing as well as possible. So keeping it trimmed short, filed down, etc., so it doesn't snag on other things or get more injured moving forward. Treating fungal nails can be really difficult because even if you clear the fungus, you're very likely to get reinfected at some point in the future. The most common and best treatment for fungal nails is an oral antifungal medication that you typically take once a day for 3 months. And I'll let you discuss the pros and cons of that with your dermatologist. But there are some patients who say, listen, I'm bothered by this, but not enough to take oral medication. Are there topical options? So let's talk about that too. First of all, there are antifungal nail lacquers, so sort of like a nail polish that you apply once a night, but you have to apply it once a night for almost a year to increase your chance of having success. And even then, your chance of curing your nail fungus is under 20%. So I just find a lot of patients don't want to do something every single night for a year with that small chance of success. There are a couple of home remedies for fungal nails, and they work because they contain an antifungal ingredient called thymol. Now, of course, these are not going to work for everyone, but I feel like every dermatologist I've talked to has had at least one patient have success treating their fungal nails with either Listerine, and not any Listerine, but the gold or yellow Listerine, the original one, that's the one that has thymol, or with Vicks VapoRub. With either of these, you would apply them every single day to your nails for at least a few months. And as a reminder, when you're treating fungal nails, and this goes for if you're using prescription or home remedies, you're not looking for the nail plate that already exists there to change colors. That's not what's going to happen. That that nail plate is dead. But what you're looking for is down by the cuticle, the outgrowth to be clear of fungus or to be growing out as a normal nail. If you have cleared your fungal nails with either of those home remedies, please let me know in the comments. If you do clear your nails of fungus, then you want to make sure that you don't reinfect your nails, which happens in about 50% of people. So things you can do to reduce this risk are avoiding cutting your cuticles, wearing footwear in public spaces, and then using sterilized instruments, whether you're getting a professional pedicure or you're giving yourself a pedicure at home. The other thing you want to do is get rid of your old shoes that you had when you had fungal nails, because the fungus lives in there too and can more easily reinfect your nails if you're wearing those shoes again after you've cleared.
So there you have it. With these simple tips, you'll be on your way to healthier, stronger nails in no time. If you enjoyed this video, don't forget to hit that subscribe button and join the HFB.Lifestyle community for more health tips and tricks. Stay fabulous, friends.